Last week on our show, we had Mary Alice St. Clair with Halosil. What can you tell us about how that system has worked for Artesia? And maybe first, what type of vetting process do you go through before you implement a system like this in your institution?
Well, I think you have to look at your background. What have I been associated with? What I've been exposed to, even at these big facilities. Kaiser Permanente is this huge conglomerate, right? Northern New Mexico had 23 facilities, and that's just a huge, huge conglomerate. So I had the opportunity to learn a lot about infection control working with them. They were pretty much already going down the path of total room disinfection with UV robots, and we had the opportunity to bring in a gentleman with a Halosil system and talk to us about total room disinfection. And I really thought it was better technology. I was limited in what I could implement there. The way the political structure was, and the facility service director had already put all his eggs in the basket for a UV robotics for the OR. And so that's the way we went. So as I came down here, it was one of the things I really thought was the technology you wanted to use. It's cost effective for a small hospital. It's one thing if you have really deep pockets, Kaiser Permanente does. It's a different situation in a mom and pop hospital out here in the middle of nowhere, really, to be able to provide that type of service. So we brought the system in. It works pretty well with us here based on our surgical load, and we can easily shut down 2 rooms at a time, fog 2 rooms at a time, and then have the other 2 rooms available for trauma or for cases that we still have pending. And then we use our HVAC system just to be evacuated out after the appropriate dwell time, and we go back in. So we've been using it for over 5 years now.